Hi, everyone. Welcome. I'll just give another minute for all of our participants to join and we'll get started. All right, wonderful. So welcome everyone to today's alumni panel for prospective students at the Harvard T. Chan School of Public Health. My name is Ngan. I'm an assistant director of admissions at the admissions office, and it is my pleasure to be here today as the moderator for this panel. Just a few notes on logistic. You can ask the questions anytime during the panel by using during the session by using the Q&A button found at the bottom of your screen. And now it's my pleasure to introduce you to four of our most wonderful alums who are here today. We have Diane, Regan, Violetta, and Neil. And since Diane is first on the slide, I would like to ask her to introduce herself to the group.
Thanks, Nan, and thanks everyone for joining. This is going to be an exciting session. So I'm Diane Wu. I did my degree, my Master of Public Health at the Chan School back in 2014, it says officially, but it was actually 2011, 2012 when I did the degree. I had come in as a third-year medical student at the time from Canada, and did this degree kind of between my third and fourth years of medical school. And now I'm a public health and family physician. I'm currently working at the World Health Organization in Geneva, so I'm calling in from Switzerland. And I'm working effectively as a chief of staff for one of the senior management of WHO. And we're responsible for the division on communicable and non-communicable diseases, responsible for about 260 staff and a budget of about 200 million. So it's at the moment, it's a lot of kind of internal coordination. I'm happy to talk more about that when we have time, but very happy to talk more about my program at the Chan School and answer any questions. Thanks.
Thank you, Diane. I'm so happy that you're able to join us today. And now I'd like to ask Violet to introduce herself, please.
Hi, everyone. Again, thank you for being here, and so excited to share some about our experience at Harvard Chan. I live currently in New York City. Prior to starting at the Chan School, I founded an organization called Macer Health. We focused on elder care and nutrition and preventative medicine for the aging population. After I graduated, I continued expanding Macer and adding new service lines. We currently across 4 different locations in New York, and we have additional service lines such as transportation, nutrition, and sort of just continuing my work with Macer.
Thank you, Violet. Thank you for joining us. And I'll pass it over to Regan.
Hi, everyone. Thanks for taking the time to be here to learn about HSPH. It's really an amazing place. From my background, I studied public policy and design in my undergrad at Dartmouth, and soon after graduation became very passionate about food systems and nutrition, and was actually a practicing nutritionist and health coach for some years. And I was working with individual clients, and the more I worked with people, the more I realized how many systemic issues are working against us when we try to be healthy and try to help our families be healthy and try to, improve our diet quality. There was just so many structural issues, especially in the United States and the food system, that are holding us back. So I was very curious, started to go back to my policy roots and wanted to get a 30,000-foot view of, nutrition and systems, and found the HSPH program. It was actually the first cohort that they did in NPH in nutrition. So I was a bit of a guinea pig in that sense. But the program just fit my needs exactly perfectly. And during the course of my time at HSPH, I became increasingly passionate about the intersection of food systems and climate and sustainability issues. And if any of you on the call are interested in that, HSPH has like a very, very robust climate and policy and a sort of ecosystem. But at that point, I was working with professors in my department, and they encouraged me to cross-register into an HLS, which is Harvard Law School course on food policy. And that was like a very serendipitous, like light bulb aha moment for me in my career, because that class was taught by my current boss. So I took that course as a cross-registrant and fell in love with the discipline of food system policy. And long story short, 4 years later, I'm working at that very same clinic, the Harvard Law School Food Law and Policy Clinic, as a policy analyst working on food system sustainability issues. So that is my HSPH story, and happy to chat more about any of those different elements. Met my current boss and all of my best friends at HSPH. So very, very positive experience for me.
Thank you so much for sharing that, Rhea. What a wonderful story. And then last but not least, we have Neil.
Mhm. Great. Yeah, thank you so much. I'm so happy to be here. I began my career at the U.S. Environmental Protection Agency, and it's hard to believe, a bit over 20 years ago. I graduated from Duke with a master's in public policy, became a presidential management fellow, and then found my way into a group within the agency that quantifies the number and economic value of air pollution related health impacts. For anyone who's familiar with risk assessment, at least the type of risk assessment that's done in an environmental context, epidemiology is a critical input. And it's not an exaggeration to say that were it not for the work of a handful of researchers from Harvard Chan, we would not be able to do the work that we do here. And that was part of the driving force for me wanting to go back to school, is because I wanted to better understand the principles of epidemiology and actually be able to perform primary research to inform the work that the agency does. So thanks very much. Happy to be here.
Thank you, Neil, and thank you for all of you for being at the panel today. We're so excited and we're so grateful that you'll be able to make it. I'll stop sharing the slide now, but just one last thing to our participants. If you have any specific questions about the admissions process, please contact us via email, phones. We also offer virtual office hours as well, and you can find those opportunities via our website. And now, if you have any questions for our alum panelists, you can pop them in the Q&A option at the bottom of your screen. Okay, great. I see that a few questions are coming in, but I would like to start by asking our panelists about how do you feel that your particular public health concentration in, during your time at Chan School prepare you for your career today? And anyone can start.
I'll jump in first, I guess. Oh, sorry, Neil, did you want to go? So my concentration was in healthcare management. It was a wonderful cohort. We trying to remember the exact numbers. I believe it was like about mid-20s of us, and we all came from different backgrounds and were able to share experiences from the past, but also sort of study together and maneuver through the complexities of the healthcare system. The small cohort allowed us to really connect with each other and create an amazing network, but also provided the fact that my focus was also always from the business and administrative perspective. I really needed to tune up my understanding of managing through healthcare organizations and what it meant from admin point of view, but also as a leader, what it meant to guide individuals who I'll be working with, coworkers, etc. And I truly think that through various leadership classes that were offered specifically for the healthcare management, but also across ability to cross-register with other schools, allowed to tune up on other areas such as public speaking or negotiations, and generally just understand what healthcare was going through at that time. When I started, it was right before COVID, and then when I ended, it was right at the tail end of COVID. So just even kind of understanding that process and what has happened in the healthcare world at that time was extremely important for me. Without that knowledge, I probably wouldn't have been able to take my company from where it was to now, and I'm truly grateful for the people that I've met through in my cohort, through the school, as well as the knowledge that I gained.
I can go. So I did the concentration in global health. So I came into the program knowing that I really, really wanted to work in global health, and I found it kind of the Chan School was really my main way to pivot into my current work in global health. So I was pretty set on doing that. I was thinking about the health policy and management concentration too, because I was really interested in that intersection between, I guess, health and more of the strategy aspects of it and the political aspects of it, and I thought that would be a good way to go. But ultimately, I found it useful, and whatever concentration you choose, you will still be able to constantly interface with people across all of the other disciplines. So I wouldn't stress too much about your choice there. Yeah, I found it really important. Some people are asking about choice of school. The people that I wanted to learn from were mostly based at the Chan School versus others. Some of them have retired so far now, but some people were leading research that I was really, really interested in, and I found it to be a really important place to be at the time that I was at the time. I didn't even apply to any other school, actually. It was Chan or no MPH for me.
Go ahead, Rian, sorry.
Yeah, I'll just be quick. Diane, I was going to jump in because I'm the same. I was also MPH at Chan or bust. But for me, it's quite obvious. I mean, I work in food system policy, so the nutrition degree was a very clear fit for what I want to be doing, and it gives a very, very broad overview of the types of work you can do in the space of nutrition and food systems, which I wasn't aware that there was so many different ways you can flex these kind of skills and interests other than just being a nutritionist. So that was very eye-opening to me. My cohort similarly was very diverse. Folks that were physicians, folks that were startup founders, folks that were interested in bench research and lab work. So we really had a very broad group of people to learn from, which was really exciting. And I will just say that my office now in the law school clinic is all lawyers except for me. I'm the one like token MPH public health, public policy person. And they're often coming to me and they're like, how do we make this legible for the average person? When I read the document, it's like legalese and it's completely unintelligible. And a lot of the work we're doing is trying to make information accessible to different types of stakeholders. So I have that unique skill of being able to really communicate public health related topics in very like easy to understand ways. And then also a lot of the work we do has to be science backed. And a lot of the times we're referencing studies and referencing research. And not to be mean to lawyers out there, but they don't know how to do that in a correct way. So I'm often the go-to person in the office to sort of say, okay, we want to write an introduction about why this policy is so important. And a big piece of that is understanding the research that's going on in nutrition. And that is a very specific and very valuable skill set that I got from my degree.
Yeah, just to echo the comments that have already been made, Harvard Chan was an easy choice for me because at least in the field that I work in, environmental epidemiology, my sense is that particular field at Harvard Chan has a comparative advantage in. It's probably not an exaggeration to say that a large reason why there is a standard for lead, for example, or for fine particles is because of the work that researchers like Joel Schwartz and Doug Dockery have done. So I knew when I wanted to learn epidemiology, I knew this was the place that I wanted to do it. And I will say that I won't mention the last presidential administration, but EPA gets a lot of scrutiny, not least because the benefits, quantified monetary benefits of our program are larger than any other federal program. And the reason that they're larger than any other federal program is because of the epidemiology that's used to quantify changes in air pollution related risk. And so I knew that if I wanted to be in a place where I could understand and defend and advocate for the work that we do, I needed to go back to school and get the right training. And I knew that THChem was the place to do that.
Thank you so much for sharing. I saw another really great question from the Q&A. So the question is, what was the most exciting part about the Chan School curriculum for you?
I don't know if this is the right answer, but the first thing that came to mind for me was just how intimate most of my classes were. And that was exciting to me when I was looking at other schools and programs that were just like these giant cohorts. There was only 9 people in my cohort. So I was really excited about the ability to really get to know folks on a personal level. And I think a lot of the HSPH cohorts are similarly intimate. Actually, one anecdote, our nutrition professor actually brought us all over to his house to do a demonstration of cooking skills. And the degree isn't about cooking, but it was a really nice way to connect with the faculty in like a very unique way. And that was a big highlight. So for me, the curriculum was perfect in terms of what I was looking to learn, but also like the format of the learning was really important to me.
I'll just note, I'm sorry, Diane, did you want to go ahead?
Oh, no, go ahead, Neil.
Okay. I'll just note briefly, being a mid-career team lead at EPA, I wasn't in a position to move my entire family to go back to school. So the hybrid format worked very well for me. There were meant to be 2 3-week periods in which our cohort would take classes together. Because of COVID, there's only a single 3-week period. But even that was such an incredible opportunity to work with people face to face. Everyone in my cohort was extremely congenial, lovely to work with. So grateful to have had the opportunity to meet and to work with them. In terms of coursework, probably the single most important and also the single most challenging class that I took was one on controlling for confounding, which is obviously a very important topic when you're thinking about environmental epidemiology. So it definitely stretched me, but I'm glad that I took it, and it was very worthwhile.
I was just going to say, I think the most exciting thing about the school in general was how flexible it was. Like, I think a lot of people come to an MPH from extremely either diverse interests or from just things that don't really fit in a normal box. And the school is so supportive. I think Reagan was talking earlier about taking classes at different Harvard schools. Almost everybody I knew, I think, was taking classes at different Harvard schools and sometimes at MIT. And I think just like that diversity of opportunity there is great. And generally people say yes. If you say you want to, take something that's completely not related to what your major is or your specialization is, it's fine. I think that is probably something that many other MPH programs don't offer. And when you're at Harvard, you can do that.
Just to add to all of these great things that were said, I completely agree with everything. My first class was a 1-week-long leadership course, which was an incredible. I don't know. I don't know if it's across all the cohorts, but it was an incredible way to meet everybody and really get to know the students on a very intimate level. And when the course ended, it was just 5 days, 1 week. The professors hosted a dinner at their house, and just kind of piggyback on what Reagan said, like the professors are so available and are there to truly answer your questions or help you guide through what issues you might be facing or what thoughts you're thinking, and kind of have that relationship, not just with the students, but also with faculty, was one thing that truly stood out for me.
Thank you everyone for sharing your experience. To the participant, I just want to mention that as a student of the Chan School, you have the opportunity to cross-register across all of the rest of the Harvard schools. So if if you're interested in policy, for example, you can cross-register and take class at the Kennedy School, maybe the law school, or the business school. And you also have option to take classes as electives at MIT and Tufts as well. And currently, most of our programs are residential nature, meaning you have to be on campus. I think the program that Neil, attended, the MPH in Epi, is has a more flexible format. So it's the MPH in epidemiology. It's a hybrid option. And then during the pandemic, we rolled out the MPH in generalist, which is a 100% online program. So those are the two, I would say, more flexible in learning format if you're interested in that. But then the rest of the programs, such as nutrition or global health MPH programs, they'll be in person. And I just saw another really great question from the Q&A. So this question is from Ninu. Sorry if I mispronounced your name, but the question is, what other opportunities during the program you feel that you should have leveraged more?
So I don't think I regret anything from my time at the Chan School. And again, this was for me about 12 years ago. So my answers might also come with a grain of salt. But I don't. I think looking back, maybe some additional quantitative courses would have been useful. But I think in general, I was really happy with the program and the choices of degree and the choices of classes I took. Of course, you wish that you were there a bit longer and had time to take some more classes and work with some more people. But that was my experience. So no real regrets, but probably some more quantitative skills would have been good.
I think similar to Diane, it is a short program. I mean, for me, it was 3 semesters. I had ended up being 4 because I went part-time during COVID. But I think it's totally expected that you're going to feel like there's just so many options and so many opportunities and just not enough time in the day. I found myself constantly getting excited about something new, or I would learn about a leadership course at the Kennedy School, and by the time I found out about it, it was already too late to do it, because it was, it's the nature of a school like Harvard where there's just so much going on at any given time. But I think like my words of wisdom there would just be to be hard on yourself, not to take on too much, because that's very easy to do because everything's exciting and everyone's doing something cool. But then also just keep your eyes open and be willing to, try something new and keep the door open for possibilities, and recognize that, this is 2 years to explore and to learn about new things. And I've definitely shifted my mindset multiple times over the course of my time at HSPH, just as I started to meet new people and do new research and join new opportunities and new experiences. And then another really, just coming to mind, another really unique and cool part about the Harvard experience is that, like we're just talking about, there's so many different Harvard schools, and there's a lot of inter-school opportunities for whether that's social or leadership, or I know one in specific on climate change. There's a lot of opportunities to bring graduate students from all the different schools together, which lends to really, really interesting conversations and really a lot of growth, because you're learning from someone who's studying about religion at the Divinity School, but then you're also learning from someone who's an engineer, and bringing all these different perspectives to sort of these complex global issues is really, really exciting. So I definitely recommend, if you do decide to go to HSPH, to take advantage of some of those cross-school opportunities too.
I'll respond briefly by saying, as I was thinking about how to answer the question, I was struck by actually how in some respects I might have been a slightly too ambitious in the coursework that I took on, particularly my master's project. That probably was more like a PhD thesis, and that's not to say that it couldn't be done. It was just that I probably should have pumped the brakes a little bit. And I think looking back, I think I got to where I was because I was just so excited to be in a place working with people who knew this material, and who were interested in collaborating, that I think I just took on more than I probably should have. Having said that, it worked out fine. I got it done. So there's a little bit on the stressful side.
Nothing really to add. I agree with everything that was said. It's a lot. We're trying to find how to there's just so many hours in a day, right? And how to truly manage through that. And honestly, one regret is I wish I just, maybe went part-time and extended my time and did it for longer. But, a program is a year and a half, 3 semesters. So there's just, it gets busy. So kind of just figuring out how to manage the time is the critical piece here.
Thank you all for your insights. I saw another great question from Chris Shanga about the practicum portion of the program. Would you be able to share your experience about that piece?
I can talk a little bit more about my practicum project. I was really interested in learning how to undertake a full-scale epidemiologic study of the type that you would see published in the top-tier journal. And in order to do that, it stretched me a lot because I had to essentially assemble more or less everything that I had learned to that point in coursework, plus working very closely with an advisor, plus also enlisting the support of a very helpful postdoc who walked me through some very tricky R code. And like I said, the project very much stretched me because it forced me to learn aspects of air pollution epidemiology in particular that I wasn't previously familiar with. And having done that, I feel like I'm now very well positioned both to take on additional similar work, but also to have a much more realistic expectation of what I can accomplish within a constrained time period.
I can jump in. I had a really great practicum experience, and this is kind of hard to believe, but I'm actually still working on my practicum. But that is because I ended up taking an internship with my current clinic as a practicum experience. And the project that we ignited during the course of my practicum lives on today. And I'm still actually working on it and building on that same project. So I have probably a unique love for my practicum just because it's still part of my day-to-day experience. I will say in terms of wisdom regarding practicum, at least in my experience and in my cohort. So I'm not sure what the restrictions are for other degrees, but within the nutrition cohort, there's a lot of flexibility, which I think was really, really cool to see and exciting for folks in my cohort, because our staff and our professors were so supportive of us exploring things that were exciting to us, whether those be specific internships, projects, research. Even some folks were doing volunteering, talking about nutrition, like misinformation, and doing public media posts about that as their practicum. So really the sky's the limit with the practicum experience, as long as you're able to apply your learnings from the program into a specific real world tangible output. So I think one of the nice things about it was just how flexible it was, and that lended for a lot of creativity in the process of folks deciding what they wanted to do for their practicum. And then it made it that much more exciting listening to the presentations on the other side, because people really took the idea and ran with it, and there was so many different different iterations of practicums that you end up learning a lot about a lot of different fields related to nutrition just through experiencing your cohort's practicums. And I don't recall exactly, I think that there was an opportunity to learn from all the practicum posters. Violetta, you were there with me at the same time. I think there was like a big poster session where you could see everyone's practicum in all the other different degree programs too. So you were learning all sorts of stuff about climate or maternal health or infectious disease. It's just a really cool experience.
Yeah, no, absolutely. And agree. So the way the practicum is set up is you're not just learning through your process, but also through exactly what your peers have done. And it's incredible just to learn how many different ways you can get involved in public health and how many projects you can do. For me, similarly, the project that I started during my practicum actually lives on today. It was a new service line that we've added that focused on nutrition at Macer, and it lives on today, and it's one of our more successful offerings. And I'm very proud to say that it all kind of happened at the Chan.
That's so wonderful to hear. Thank you so much for sharing. So I mostly work with, prospective students and not much with current students. I'm learning something from each of you today, which is great. I So the next question I saw that was a good question was about the community at the Chan School. So what do you think was unique about the Harvard Chan School community and how you were involved with the community?
Um, I think we kind of touched on it a little bit and just spoke about how small the cohorts are and just an ability to truly intimately get to know each other, because a lot of the classes are done together, but then there's obviously opportunities to expand and cross register, etc. And I think just being part of a group that is that small and you can learn from them day to day has truly made my experience very positive. But there are so many other ways of building the community. I mean, just one thing that comes to mind right away is like we all have lunch at the same time. So I remember the cafeteria and how fun and busy it got, and sort of everybody were sitting together at these round tables and chatting and sharing experiences. And that just sort of what first thing that came to my mind is that you don't even need to search for ways to build a community. It is there and it's welcoming.
I definitely echo that experience. I think I don't remember being in a more impressive and exciting room than the first day of the degree. We had this giant sort of seminar room. There must have been 200, 300 people in there, and we were asked to speak to the person on our left and our right and get their little life story and share what brought you there. And I remember just being floored by how cool the people sitting next to me were. One of them had just moved from like Burkina Faso and had been like saving babies, and the other one was like a startup founder who was doing this amazing technology. And I was just like, oh my gosh, what a room to be in. So I think in terms of community, what really helps HSPH stand apart, besides the fact that everyone's very accessible and very approachable and kind, is just how impressive everybody is. Everybody has like such passion for what they're studying and what they're doing. And anyone who ends up in the doors of HSPH is a world changer. It's someone that wants to make their mark on the world and do something positive with their life. Otherwise, they would certainly not be getting an MPH. That's for sure. They'd be at like the business school or something, trying to make money. But no, I think that HSPH just brings together folks that are really passionate and dynamic. And I think to Violet's point on like the community being built in, I always just think of Kresge, which is like the little dining lobby sort of cafe area. And the number of times you'd be sitting at a table and some new stranger would come and sit down next to you and just introduce themselves and be fast friends is I can't even count how many times that happened and how many friendships were formed in that little cafe that just sort of is the centerpiece of the school and brings everybody together. So I definitely can't speak more highly than than of the community that I was able to meet through the experience.
The only thing I would add is I was impressed both by how collegial my classmates were, but also how intellectually curious they were. I'm sure that there's a selection bias. If you're going into an MPH program, you probably have those attributes already. I was a little concerned because I did the hybrid program. I wasn't exactly sure what it was going to be like to be collaborating with folks located throughout the US and actually throughout the world. But the process was actually pretty seamless. And so that didn't encumber me in the least. That was a pleasant surprise.
Yeah, I don't think I have much to add. I agree with everything that's been said. That your colleagues are amazing, the community is amazing, and everybody is great. So yeah, I think it's a really good place to be.
Thank you all for sharing. I want to add to just to share with the participants that there are also many different wonderful student organizations that you can join on campus. And then if there's something that that you like to be involved in, but it's not there, you can always submit a request to start your own student organization, which is something really great as well. So I just wanted to bring that up as well. And another great question that I saw on the Q&A, it's about how you find balance between classwork and then any other commitments, maybe projects that you're working on or part-time job that you were doing at the time.
Yeah, I'll talk to this or speak to this issue briefly. I might be unique in this respect because being in the hybrid program, I think most, if not all, of our cohort was also working full time, as well as taking, I guess, 3 classes, so like 12 hours, maybe 9 hours. I can't recall now. But it was challenging for sure. I very much had to rearrange my work schedule and elements of my personal life to create the space that I needed to give myself, I guess, sort of the mental space to be able to both do a pretty demanding day job and then have enough, I guess, sort of intellectual stamina left over in the evenings and the weekends to do schoolwork, some of which was really intense. So for sure, it's a balancing act. And I think we're a longer program than 2 years. I'm not sure what that would have looked like for me, but I was able to make it through 2 years.
I think one thing to add is just sort of understand how you work and kind of what side things are happening in your life. I don't think there's one true answer of how to get this done. It's I mean, I was running a business. I'm a mom of 2. My kids stayed in New York. Thankfully, I have a partner who was able to handle the family side of things. Thankfully, I had amazing partners at work that were able to step up and take some of the day-to-day of my job from me and let me focus. That said, it can get very overwhelming. Once you start the schoolwork, you see all of the options out there. You want to participate in everything, and it can definitely get very challenging. And at some point, you just have to put a stop and say no to things, or just kind of manage through what's important to you and focus on that. So I guess there's no really good answer to that, but it's just about managing your time and what you want to achieve at the end.
Wonderful. Thank you for sharing. So there's a lot of questions in the Q&A that I saw that's more specific towards the admissions requirements and also financial aid. So I just want to point out to our participants that you can always connect with the admissions office on those. I'll post the admissions contact information in chat, as well as financial aid contact information in chat for those questions. And then to our panelists, I like to ask about so how did your career path differ from what you first wanted to do, or maybe, when you first attended the Chan School?
So yeah, this is a great question. I mean, I think I ended up doing pretty much what I wanted to do. So I don't know if I'm a very good person to answer that question, but it did help me to strengthen the fact that I really wanted to pivot away from clinical medicine and into public health. I see there's a couple of physicians listening in on the line and are also asking a lot of questions about should I make the move and so on. I think for me it was clear that I wanted to do something with a broader impact and not just something on the individual patient level. That was really interesting and extremely rewarding. And I think it was really important to do that first before doing the kind of work I'm doing now, because it really informs the kind of work I do. But just to say, I think I came into it knowing that I wanted this. I didn't know that I wanted to work at WHO specifically, I suppose. And a lot of my colleagues who were also part of the MD MPH program, they've gone in all sorts of different directions too. Some of them have launched startups. Some of them have gone back to clinical practice. Some have started to work for consulting companies or gone into government, like the Foreign Service. A few of them have ended up at WHO in different places. Some of them have gone into industry or started their own hospitals. So it's really all over the place too. Yeah, I guess my path was one of the most, I guess, sort of boring paths, in that I kind of went into the program and then I went back and I finished my medical school and residency, and then I went straight to WHO. I did also a 3-year stint at the World Bank in the meantime, but otherwise I've kind of come back to WHO. Yeah, I don't know if that's answered the question, but hopefully helped a little bit in some people making their choices.
Thank you, Diane.
I was going to say, I can just add that I think a lot of us go into the HSPH program with like a sort of semblance of an idea of the type of work you'd like to be doing. But one thing I will say is that HSPH did a wonderful job of sort of giving you the spectrum of how that work can look. So I, like I shared earlier, wanted to be working in nutrition and food systems. And that feels very nebulous until you actually put some legs on it and you're like, okay, what would an actual job look like in to be able to make the impact that you want to make? And I will say that both my cohort mates and the staff and professors of the department were very valuable in helping us brainstorm, like, okay, we want to be making this type of impact. This is the type of work we want to do. This is the type of lifestyle. Like, I'm not a coder, so I shouldn't be going into software engineering. I'm going to be like doing the type of work that is more advocacy based, because that's just like the type of thing that's attractive to me. And so having those elements in mind of what you want to be doing, the program's very good at helping you sort of shape and mold that into what would look more like a career path than just a passion, if that makes sense.
Wonderful. Thank you for sharing. Is there anything else our panelists would like to add on that? Okay. So I just to add on to some of the points that's been mentioned earlier about career paths and supports, and to answer a few questions about support from the school when you're looking for jobs and things like that. So we do have a really great career services office on campus that offers a lot of support from the smallest thing like writing your resume, interviewing skills and things like that. They'll bring employers on campus to meet with you throughout the year. And especially after the pandemic, there's a lot of opportunity to engage with the career services and employers online as well. And it's for life. So at any point, even if after you graduate and you need help or anything like that, you can always come back, and we'll be very happy to support you. And now to moving on to the next question. I like to ask our panelists if and when you're interviewing for a position at your organization, what are the top 3 skills that you want to see? And I'll pick on Violet since she owns her own company.
Yeah, to me, I think when I personally look for a colleague, what's important is just the soft skills. While absolutely those all of the quant skills and all of the technical skills are quite important, and there's so much focus on it at Chan. To me, the soft skills play a huge part because just being able to converse with someone, and especially I'm in elder care, so we deal with one of, I would say, probably more challenging age group. And just being able to understand and speak to people and truly just feel what people are going through is, to me, one of the more important skills. And maybe this is not the answer that we're looking for, but that's just how I personally look at it.
I can speak briefly to the types of attributes that we look for at EPA, particularly in the office I work in. Those who thrive are able to both master really complex technical information, be able to lead highly complex technical projects, and be able to characterize results in a way, particularly for political appointees who don't have a strong background in, say, public health or epidemiology, in a way that they can access that information and act upon it. That's exceptionally difficult to do because most of us are really good at one or the other, but not both. And so I will say that the training I got from Chan, I feel like helped, particularly on the quantitative side, be able to build both of those skills.
I would also say for my current work at WHO, I also kind of am at the interface between the really highly specialized technical teams who, hold the global data on malaria or tuberculosis and do all of the statistics and the analysis, and the political appointees who are making the decisions, advocating to governments, influencing the ministries of health. And and I think really, really solid diplomatic communication skills are really the biggest thing. There's a lot of big personalities at my organization, and your ability to manage them and keep a good relationship going between them is probably the most important thing. And then probably this is applicable to every organization, but just the ability to not give up and to really work on something, even if it seems really challenging. You won't probably see any impact at the policy level within a few days or weeks, but over the course of years, you can start to see some changes, and that keeps you going. So that's probably something to look for. And then specifically for WHO, having some what we call, field, quote unquote, field experience, particularly, or just some experience in lower income countries is often helpful. WHO is not an organization specifically for low income countries, but because a lot of work does happen there and a lot more assistance needs to be done there, we like to see people who have worked, have some experience or exposure there, and also people who have worked across different partner agencies, programs. Of course, this comes with time, but some of that experience is good.
I'll just add, because I think that what Diane said pretty much encompasses what we look for in like a policy clinic as well. Key points being, well, I personally really love working with people that are self-starters, that they take initiative, they're creative thinkers. Policy can feel a little bit route sometimes, and you find yourself boxed in, but some of the most exciting innovations in policy happen when you think outside the box. So people that are willing to step forward with maybe a little bit of a crazy idea, but why not? Let's explore it. So I really, really appreciate thinkers like that. And then to Diane's point, um, communication skills, both written and verbal, and just interpersonal skills, kind of harkening back to Violet's point. With policy advocacy work, a lot of it is relationship development, whether that be with partners, coalition building, getting the ear of someone in DC that's willing to take your idea forward and help implement it. On the policy sphere, a lot of it is being able to communicate, and also, to Neil's point, distill sometimes quite complex legal issues, and being able to distill those into a way that the average person who doesn't have a legal background will be able to understand them and appreciate them, and being able to communicate the policy suggestions and advocacy work, which in reality is quite detailed and nitty gritty, in a more sort of holistic way, where it's like, okay, I'm not going to read you the legal brief. I'm going to explain it in a way that's exciting and motivating. So the communication skills are key. And also just a passion for the work. I think you can tell when someone applies to work in your space that really cares and really wants to make a difference. Those are the people you want to work with, right? You want to work with the people who are going to link arms with you. And like Diane said, it takes a long time to see change happen. So you have to be in it for the long haul.
Thank you so much for all of your wonderful insights. Realizing that we're almost at the hour, I would like to pose just one last question. If you have any one final piece of advice for a prospective student weighing different graduate school options, different public health graduate school options.
It's a good question. I think it's really dependent on what the programs offer, I suppose. And it's a very personal question for whoever is, it looks like the people attending this session are coming from a lot of different backgrounds. So I would say, the way I got into the MPH program, or knew about the MPH program, was I had a colleague who had done the program, and I said, wait, yeah, I didn't know you could do an MPH program while you were doing your medical degree. And she said, yeah, that's great. It's a really great thing. Come and do it. And so I think it's, talk to people around you, find people who have done these programs and talk to them in more detail about your specific situation and what makes the most sense maybe for you. Because it's really dependent on your experience, your background, your life stage, what you're able to do with kids, without kids. So yeah, just do more digging and more research.
I think on that note, it's clear Neil did this well, but I think look at the people that you'd be working with and studying under. I did a ton of research on the professors in the nutrition department prior to applying. And I made sure that the work they were doing and the research that was happening in the department was interesting to me, because that's what you're going to be immersed in, and also the folks that you're going to be working with. So if you look at the staff of your department and you're like, holy smokes, these people are so amazing and incredible, and I want to learn from them, then it's a good fit. But it may be that you look at another school and you're enamored by the folks that are positioned there, and then that might be a better fit. So I think, to Diane's point, it's truly very personal. But for me, I even had meetings with some of the professors prior to even applying. I was like, is this going to be a good fit? Am I going to like the people I'm learning from? So I think doing your research, not just applying widely and sort of playing a guessing game, but just being intentional and really seeing and making sure that you have a plan of what you want to get out of the program, and that the program fits and will help you get there on the other end.
I will add briefly, and this sounds really obvious, but I think particularly if you're going into a hybrid program, making sure that you've allotted sufficient time to actually do the coursework and do it well and not shortchange yourself. Because it's a big investment of time and resources. And you want to make sure that when you're going into it, you have the time and the space that you need in order to get as much as you can out of the program.
I'm just gonna mention one more thing, and it's location, right? So like a school that is located in Boston, where so many organizations call home, and as well as just sort of having so many connections to other companies on the Northeast and globally. I mean, just based on this panel, we are all in different parts of the world, so it just allows where do you want to end up and what kind of resources the school can offer for you to be there.
Thank you so much. Thank you so much again for all of your passion, your wonderful insights, knowledge, and your honesty. I'm so wonderful. I'm so grateful that you're able to join us here today. And I know it's, you're all in different parts of the country. I think Diane is not. I think Diane is in Switzerland. So thank you for taking time out of your late night to join us today. I'm sure our participants are so grateful as well. And to our participants, please, connect with us via the virtual admissions office hours anytime. We're always here to answer any questions. And on deadlines approaching, it might be very stressful, but we're always here to answer questions. And again, thank you for our wonderful panelists that are here with us today. My name is Ngan. I'm from the admissions office, and I'm signing off from Boston. Thank you so much again. Have a wonderful day.
Thanks, Nan.
Thank you. Bye.
Thanks. Good luck, everyone.
Thank you. Bye.